Good morning, everyone. Thank you for being here. Today, I am proud to sign into law House Bill 696. I'm pleased to be joined by Senator Benton Sari, Representative Sarah Crawford, Josh Dobson, who is president of the North Carolina Healthcare Association, and Margaret Stargell, CEO of Coastal Horizons, as well as you can see, numerous legislators, experts, and advocates. Today, we are bringing welcome news to the people of North Carolina. We are reinforcing the state's healthcare system by fully funding Medicaid. When it really matters, state leaders of both parties can come together and do the work of the people. A few weeks ago, I presented my critical needs budget to the General Assembly, a list of funding priorities for services that are in distress. And today I'm pleased to report that a number of those priorities will be funded. First, we've protected Medicaid for millions of North Carolinians. 3 million North Carolinians, that's more than a quarter of the population of the state, get their health care through Medicaid. This number includes children, pregnant and postpartum women, seniors, people with disabilities, and working families. Medicaid covers more than half of all of the births in the state. And Medicaid is the primary payer for behavioral health services in the state, which gets people care and keeps communities safe. For months, the status of Medicaid in North Carolina has been in unnecessary jeopardy. But I'm relieved to say that the bill that I will be signing will provide certainty and care that the people and the providers of this state need and deserve. The bill also protects the state's Medicaid expansion population, more than 725,000 of our neighbors. I want to thank the North Carolina Healthcare Association, the Department of Health and Human Services, other healthcare leaders, and the General Assembly for their work negotiating this important fix that will protect people's health care. Fully funding Medicaid and protecting the Medicaid expansion population are two huge wins for North Carolina. The 3 million neighbors on Medicaid can go about their daily lives with the peace of mind that they can get the health care that they need when they need it with insurance that they depend on. And all of us will benefit from a stronger health care system as a result. Second, I'm gratified that the General Assembly heeded the calls for urgent action in other items in my critical needs budget. That includes addressing budget shortfalls in the Department of Adult Correction, the State Bureau of Investigations, and the DMV, all of which have faced increased workloads without enough funding to fulfill their missions and keep people safe. And I know thousands of children of veterans across North Carolina will be relieved to know that their scholarships are no longer in jeopardy. Each of these investments will help fill the gap as we work toward a comprehensive, balanced, and fiscally responsible budget this summer. This is an important bill, but I would be remiss not to highlight some of the real concerns that I have with it. As it's written, the bill will eliminate health care coverage for nearly 27,000 children and pregnant women who were lawfully present in the United States. The group includes victims of human trafficking, green card holders, refugees, and other immigrants with legal status. Depriving these vulnerable women and children health care coverage is wrong. Fortunately, based on conversations we've had, I believe that it is the General Assembly's intention to fix this. The bill also adds red tape that will force some North Carolinians to wait 3 months, longer than nearly every other state in the country, to get the Medicaid benefits they are eligible to receive. And at a time when healthcare costs are burdening working families, the bill increases Medicaid expansion recipients' co-pays for many types of doctor visits and for prescription drugs. I'm encouraged that many members of the General Assembly have seen and expressed concerns about these issues as well. So there's still time to address them and other bills in the short session, and Secretary Sangvi and I stand ready to partner with the legislature on these needed improvements moving forward. Medicaid is a critical program for the state of North Carolina, and rest assured that we are always trying to run it better. We are committed to continually containing costs and eliminating fraud, waste, and abuse at every turn. DHHS and our partners at the Department of Justice have a very strong track record here, but we can always look for ways to do even more, and we are. We also have to be clear-eyed about the rising healthcare costs and commit to longer-term actions to constrain them. Let's get Medicaid funding done for this year, and we're almost in next year already, and then let's work together as we contain costs for healthcare over the longer term. That's how we will ensure a sustainable program that keeps North Carolinians healthy. Additionally, to sustain the program, the General Assembly should appropriate recurring funding for Medicaid, not one-time money, so that we can avoid this painful process every year, protect the program for those who rely on it, and keep our entire healthcare system strong. I'm grateful to all of the legislators of both parties who played a role in this success. Many of them are here today, along with the team from the Department of Health and Human Services for their good work in bringing about this legislation. We're off to a good start to this short session, and we cannot stop here. The people of North Carolina need us to do our jobs. We owe it to North Carolinians to keep moving forward, working together, and always putting them first. My critical needs budget also called for raises in teacher pay and for law enforcement officers. An additional Hurricane Helene relief funding for Western North Carolinians remains a pressing need. I look forward to working with the leaders in the legislature and all of these legislators to address these issues and more. Today's bill signing reaffirms we can work together on a bipartisan basis and get stuff done for the people of North Carolina. So let's keep going, let's have a productive short session, and let's pass a fiscally responsible budget that keeps the state of North Carolina strong. I will now bring forward Senator Benton Sari. Senator.
Thank you, Governor. Thank you, Secretary Sangvi. Appreciate the opportunity to be here and speak to you today. My name is Benton Sari. I represent Johnson County in the North Carolina State Senate, and I serve as the one of our Senate Health Co-Chairs, as well as the Senate Co-Chair of our Medicaid Oversight Committee, Senate Co-Chair for HHS Appropriations. I do want to take a second and thank the members of the General Assembly that are here today. A lot of them put in countless hours that people do not see in bringing this bill to fruition. See, Senator Jim Bergen, he's here. If we give a round of applause for Senator Bergen. Senator Amy Gailey, who's not with us today, but she also worked very, very hard on this legislation. Behind me is actually my representative, Representative Donna White, who serves on as a co-chair for the Health Committee, worked very hard. Representative Grant Campbell, Representative Tim Reeder, Representative Donnie Lambeth, Representative Larry Potts. It was a team effort, and there were lots of central staff that were part of this. The hours that went into this to make sure that we drafted a careful and comprehensive bill that tackles this Medicaid issue, and not just the funding part that goes along with it, but what we're going to look at prospectively going forward. As Governor Stein alluded to, there are headwinds and there are challenges with Medicaid in North Carolina in the foreseeable future. We are staring at a $1 billion rebase for this upcoming fiscal year. While we handle the problem at hand of the additional $319 million, we are looking at increasing appropriations in future years. The cost of Medicaid in North Carolina has increased over 90% over the past 5 years. The $1 billion, that's money that we could send back to the taxpayers in income tax relief. That's money for state employee raises. That's investments in our colleges and our community colleges. That's investments in our state buildings and infrastructure and roads across the state. This Medicaid rebase isn't happening in a vacuum. We have a dual responsibility at the General Assembly, one to the patients, two to the taxpayers, to deliver a healthier North Carolina with respect to outcomes that are happening on the ground and outcomes that are happening in the General Assembly with respect to our budget. House Bill 696 takes important first steps in giving our Medicaid partners important tools in order to manage that cost. It gives them the ability to look at data. It gives them the ability to help people make choices with respect to where health care is delivered. And it gives them the ability to look at better health outcomes for both the taxpayers and for the patients. It also challenges the department to come up with a plan and then to implement that plan. because we're having debates about this, the budget that's going to be forthcoming and the choices we're going to have to make. And we're going to need partners at the table that are going to make that happen. I'm proud of the work that we did to get this across the finish line, but I don't have any illusion at all that this is the current solution that's going to fix everything going forward. We've got more work to do, and we're going to do it with DHHS, with our partners at the General Assembly, and with our partners in the provider community. There are millions of North Carolinians that rely on this program, and there are hundreds of thousands of people that rely on it to provide for their families. And I look forward to working with General Assembly, Secretary Sangbai, and the governor to make sure that we make that a possibility. Thank you so much for the invitation today, and I'd like to turn it over to my friend, Representative Sarah Crawford.
Good morning. Good morning. Oh, thank you. That was lovely. I'm Sarah Crawford. I represent House District 66 here in Wake County, and I also have the honor and privilege of serving as CEO at Tammy Lynn Center for Developmental Disabilities. This moment has been at least 8 months in the making, and actually much longer than that as negotiations started before August. Early last fall, we faced a real period of uncertainty, unnecessary in Medicaid. For providers and families, it felt chaotic. And I saw it firsthand. Services were at risk. The workforce, already strained, was even more strained, and people who rely on this system every day were left wondering what comes next. But this amazing group of folks that are here behind me today, that are out in the room, stayed at the table. And from the beginning, I think we all believed, though it was hard, that we would get here, that we would land in a place that reflects the responsibility we have to the people who depend on it. And I've seen that responsibility up close. Through my work at Tammy Lynn Center, I've watched our teams show up day after day for people with complex needs, medical fragility, and for families navigating incredibly tough moments. And when funding doesn't align with reality, they feel it first, and they feel it the most. And we also heard this yesterday, just yesterday, at the IDD caucus listening session. And by the way, we are the only state in the nation with an IDD caucus. So thank you, because I know many of you are on that caucus. More than 200 families showed up yesterday to share their stories, their fears, their challenges, and what's at stake if the system doesn't work. One of those voices was Matthew Schwab, who said something that I will never forget, that we all deserve safety, happiness, and independence, and that is exactly what Medicaid makes possible for so many North Carolinians, and that is why today matters. This $319 million to fully fund the Medicaid rebase this year brings stability to a system that so many folks rely on. It supports providers, it strengthens the workforce, and it gives families the confidence that care will be there when they need it and when they need it most. Thank you to Governor Stein for your partnership in getting us to this point. I know that there were many long nights, many long conversations, and to my House colleagues and my Senate colleagues and the health leaders, many of whom have already been recognized, for your leadership throughout this process. It took persistence, collaboration, and a shared commitment to getting this done. And to be clear, this is a critical step forward, but it is not the final step, as you have already heard. We must keep fighting to protect Medicaid. Stability cannot and must not be temporary for the people who depend on it every day. So I look forward to continuing to work with my colleagues, to work with Secretary Sangbai and his team to make sure that the system isn't just responsive in the moments of challenge, but reliable for the long term. Today matters so much, and what comes next matters just as much. Thank you so much, and I'd now like to turn it over to Josh Dobson.
Yeah, Josh Dobson, President and CEO of the North Carolina Healthcare Association. It's an honor to be here. We in North Carolina are at our best when we all work together to improve the lives of North Carolinians, and this is one of those times. So I want to start by thanking you, Governor, for your leadership and your commitment to North Carolina's healthcare system. Your support for Medicaid funding and for hospitals across this state is greatly appreciated. Also want to thank Speaker Hall and Senator Berger and the legislators behind me who did tireless work to get this across the finish line. Without them and everyone's support, it would not have happened. So I want to thank the legislature. I want to also thank Secretary Sangbai for his leadership, friendship, and partnership through this process. His team has been deeply engaged, and we have had weekly conversations to try to figure out how we can work together. And lastly, I have to thank Chair Brian Floyd, who is the chair of the Board of Trustees for NCHA. And really, without their support and without their approval, I would not have had the ability to work with these great legislators and the governor. So, Chair Floyd, thank you so much. House Bill 696 is an important step forward. By fully funding Medicaid and putting in place a responsible path on key financing issues, this bill provides stability for a system that millions of North Carolinians do really depend on every single day. I also have to take a moment to recognize North Carolina's hospitals. This is yet another example of hospitals stepping up for the people of North Carolina. They are caring for more patients with more complex needs than ever before. They are doing it while managing workforce challenges and significant financial pressure. And through all of that, they continue to deliver high-quality care in every single corner of North Carolina. Hospitals were willing to be part of the solution. They stayed engaged, worked in good faith, and helped move forward an approach that supports patients while strengthening the system for the long term. This is ultimately about the people of North Carolina. It's about making sure that patients can access care when and where they need it. It's about supporting the providers and teams who make that care possible. And it's about ensuring that our healthcare system remains strong and sustainable for the future. There is more work ahead, as Senator Sawery and Representative Crawford articulated. But today is a meaningful step forward. Governor, it's an honor to be here. Thank you for the invitation. Thank you for your leadership. Again, thank the General Assembly, Secretary Sangbai, for all of the work, and that's what happens when we all come together to do good things for North Carolina, and it's an honor to have the North Carolina Healthcare Association be a part of it. Thank you.
Good morning. My name is Margaret Wellis-Dargel, and I serve as the President and CEO of Coastal Horizons, headquartered in Wilmington. Coastal Horizons is a nationally accredited behavioral health and primary care organization serving 62 counties in North Carolina. I am here today to express my deepest appreciation to Governor Stein and the General Assembly for taking the needed action to fully fund Medicaid. As Governor Stein said, 1 in 4 North Carolinians are covered by NC Medicaid. This health care is crucial to the physical and emotional well-being of our citizens and thus our workforce. I witness every day through the services we provide and the individuals and families walking through our doors, the incredible impact that Medicaid has in keeping individuals and our community healthy and strong. Each day, Coastal Horizons has the privilege to see the transformation of lives because of access to Medicaid. Recently, a mother reached out to us a year after the conclusion of their family therapy, and to share not that she had seen her son back, but rather that she knew what she always had seen and understood was that there was a different one to see. He was not only not getting in fights, his self-esteem improved, allowing him to make friends. She shared his new medications, supported him like she had never seen before. Simply, he was happy like never before and showing up differently in home and school. This reduced stress in her marriage and decreased her own anxiety. She contributes the recent job promotion she received to the improved family functioning and less time calling out of work. Another individual came to us through our reentry program from jail. After multiple stints in jail from ongoing substance use-related offenses, she is now working and reunited with her children. This work did not come easy. In fact, she overdosed with us, but that moment was the last time using for her in now over 14 months. Now employed, she has started taking classes at a local community college as she pursues a career to pay her success forward. Without Medicaid rebate funding, stories like these cannot be possible. We are so grateful for the support of the General Assembly and Governor Stein in passing the rebate bill to fully fund Medicaid through the end of the fiscal year. By taking this action, 3 million North Carolinians on Medicaid are able to access the health care they need. That care results in healthier individuals and families, resulting in stronger and healthier communities. We are so grateful for Medicaid that has been kept in for this whole fiscal year. But it is just as important to continue to protect and support Medicaid next year and in the years to come, and including the changes and the fixes that Governor Stein spoke of earlier. We appreciate your support and remain confident that the well-being of North Carolinians through Medicaid will remain a priority to our state's leadership. Again, I thank you for this opportunity to be here today and express my appreciation and gratitude to Governor Stein and our legislators for their ongoing support of Medicaid services and to those providing those services. And now it is my distinct honor and privilege to turn it back over to Governor Stein for this important signing.
And it is my honor to sign into law this bill to fully fund Medicaid and to bolster the entire healthcare system of North Carolina. Fortunately, it's valid even if it's a bad signature. And it is now law.
I'm glad you got your money.
When we can free you all from the stage.